Healthcare is an empowerment. It is the wonderful ability that empowers its practitioners to help others lead healthier, more happy and more wholesome lives. It bestows great respect and great powers on the chosen few. But with this respect comes great responsibility. Across the world, this mission to heal is what drives the healthcare industry. The burning to do this well is what results in the benchmarks being continuously lifted. 100% perfection is utopian, the ideal that will remain forever just out of reach. But the effort to get there has to be 100%. The pursuit of excellence is the closest to perfection that we'll ever get. The heartening thing is that excellence is not always an Everest to scale. It is not always about path-breaking invention or game-changing innovation. And most often, excellence lies in our humble hands. Apollo Hospitals pioneered clinical excellence in India. Apollo's greatest achievement has been the fact that it has nurtured an ecosystem that has systemized excellence. Apollo not just encouraged individual brilliance, but built frameworks so that the brilliance could be templated and shared across the group. It created a culture of excellence and superior clinical outcomes. It is the age of the checklist manifesto. It is time that the comprehensive checklist culture becomes our individual and collective mantra. On-the-ground analytics and research shows that there are some areas that are more prone to errors and which have widespread implications on patient safety. The four critical parameters that have been identified are medication safety, surgical safety, infection control, and patient falls. Medication is a key facet of healthcare delivery at every stage of the treatment process. Studies in America show that 195,000 Americans die every year due to preventable errors. The numbers are significant in our region too. 1 out of 5 injuries or deaths per year to patients is a result of preventable adverse drug events. In India, several other factors compound this problem. Firstly, the family members are largely illiterate. The basic infrastructure levels like barcoding, etc. are rarely used. Lastly, due to immense demand issues, doctors in most environments are overworked. The first area of intervention is to maintain an exhaustive list of approved medications available in the organization. This is called the formulary. The second key aspect is to establish a system to ensure the proper documentation of correct medication name, route, dose, and frequency. IT helps in the accurate and efficient execution of routine and cumbersome processes. Finally, the secret to success is to check. Check before indenting medication. Check before issuing medication. Check before storing medication. Check before administering the medication. The second key parameter of the safety quadrant is surgical safety.
In the surgical field, one sometimes hears of things go horribly wrong. The wrong patient being operated on, or the wrong site of a patient being operated. One only wishes that such a thing would not happen to them during the course of their career. However, these things are easily avoided by following a few simple steps. The WHO Surgical Safety Checklist breaks down the typical surgical procedure into 3 crucial phases. The sign-in.
The sign-in stage is important to confirm the patient identity and the procedure he or she has been admitted for. For on consent from the patient, should next actions ensue. Care about anesthetics procedures, allergies, respiration problems, etc. need to be ticked off in a detailed checklist in the sign-in stage.
The timeout.
Timeout requires the surgical team to identify themselves and their roles. They reconfirm the identity of the patient and the procedure. The step-by-step breakdown of the surgical process and emergency responses is verbalized.
The sign out.
Sign out stage is to confirm that specimen is labeled, equipment accounted for, and of course, the next action points to ensure the patient's speedy recovery. Patient falls are among the most common occurrences reported in hospitals. Of those who fall, as many as half may suffer moderate to severe injuries that reduce mobility and independence and increase the risk of premature death. There are different kinds of falls. The accidental fall, an anticipated physiological fall, the unanticipated physiological fall. It is vital to prevent patient harm resulting from falls. This has resulted in the dire need to take appropriate interventions to prevent falls, like raising side rails, patient family education, lowering the height of the bed, ensuring lights are on during nights, etc. The other effective ways to curb this problem area is to detail out a comprehensive fall risk assessment report. This report takes into consideration crucial parameters like the history of falls, the need for ambulatory aids, the mental status of the patient, the degree of medications, and if there are any fluid restrictions. Hospital-acquired infections, HAIs, are probably the most easily avoided of all risk factors, but yet they take a significant toll on the quality of life for affected patients and their families. HAIs affect nearly 2 million patients each year and contribute to nearly 100,000 deaths. Increasingly more attention is also being paid to not only the human toll of HAIs, but also the financial toll.
99,000 patients die as a result of hospital-acquired infections every year. The most common agent is a methicillin-resistant Staphylococcus aureus. It's absolutely critical that we wash our hands every single time we interact with a patient. Washing hands with soap is necessary when exposed to blood, dirt, or spore-forming pathogen. In most clinical situations, it's an alcohol-based hand wash that's used. Hand hygiene is a must before and after touching a patient, before touching any invasive device used for patient care, irrespective of whether a glove is used or not. Thorough hand wash is also required after contact with any body fluid, non-intact skin, mucous membrane, or any wound dressing. By being smart, by being just a little more careful, we can create the most dramatic change in safety levels. Just a final point on the use of gloves. Gloves can never replace the need for hand hygiene. Gloves are recommended when there is contact with blood or potentially infectious material. It is vital to understand that gloves can never be reused.
Years of experience have demonstrated that IT is a huge catalyst to enhance performance benchmarks and clinical outcomes. Most errors that occur are human errors. A robust IT system can help avoid just that. Health IT holds enormous potential to propel the healthcare system to higher quality. It does so by promoting care that is safe, effective, patient-centered, timely, efficient, and equitable. E-prescribing involves prescription orders that clinicians input electronically, which are then transmitted to the pharmacy. Decision support to the clinician, such as drug interaction flags and allergy-related information, is usually included. E-prescribing eliminates hard-to-read handwritten prescriptions, as well as errors in dispensing. electronic patient data, electronic clinical notes, lab reports, etc. all help in smarter healthcare. For example, Apollo's Health Highway is the digital backbone that connects healthcare providers across the country. This facilitates greater collaboration, learning, and ultimately a higher quality of healthcare. Telemedicine too removes the handicap of geographical access and helps practitioners in smaller centers tap into expert learning and best practices. The impact on patient safety is significant. In summary, the entire patient safety philosophy stands on a few pillars. These pillars are streamlined processes and protocols, a well thought out and thorough checklist, constant communication, a robust IT background, training to all team members, rigorous and simple follow-up. This has been our credo at Apollo for the past 27 years. The results are evident in our clinical outcomes. As with every other philosophy, it becomes vital to share it with the world. In fact, not just sharing, but partnering to make it even more effective. Let's build better, safer, and smarter hospitals. Let's join hands together to work for patient safety and towards a healthier system.